Knock, knock, knock. Hi, my name's Lisa. I'm going to be your student nurse today. I'm going to go ahead and provide privacy, do some hand hygiene. Can you tell me your name and date of birth? Great, thank you so much. And can I see your wristband? Thank you, Miss Smith. All right, I got an order to do a Foley catheter today. Do you know what that is? No? So a Foley catheter is just a tube that's going to go up into your bladder to just drain that urine that's just been sitting there. It's just going to drain that urine that's been causing you to have a UTI. Is it okay if I do that today? Okay, thank you so much. So I'm going to go ahead and remove your blanket. And I'm going to have you spread your legs to the side. Ankles not touching. Perfect. I'm going to go over here and get everything set up for your Foley. Before I touch my kit, I'm going to do hand hygiene again. Perfect. Remove that. Also, I'm going to do 1-inch borders. Furthest away. Side. Other side. And closest to me. I'm going to square my box. Perfect. I'm going to remove my gloves. I'm going to grab my drape. I'm going to come over here and do shiny side down for my patient. Shiny side down. Perfect. Come over here, keeping my hands above my waist. If this was a hospital setting, I would have the table adjusted to comfortable working level, and I would also have the bed adjusted to more of a comfortable working level, elevated. So I'm going to remove the secondary mat, and I'm going to stop right there because everything is sterile, so I'm going to don sterile gloves. Now I can square my box. I'm going to go ahead and take out my alcohol. And I'm going to put those in the corner. I'm going to place my lubricant into this corner. And I'm going to attach my saline. Going to dip it into the lubricant. And now I'm going to proceed to the patient. going to clean my patient. So since this is a female patient, I am going to go ahead and spread the labia. I'm going to clean the outside, going around. I'm going to clean the inside closest to me, and I'm going around. I'm going to clean the middle, going around. Now I'm going to insert my lubricated Foley. So Miss Smith, I want you to bear down and take a deep breath. You're going to feel some discomfort, okay? And 1, 2, 3. Right. I'm seeing urine, so I'm going to go 1 to 2 more inches. 2. Now I'm going to hold the catheter in place and insert my saline. Okay. Now I'm going to test it to make sure it's in place. And it is. So now I am going to let go. Dispose of my gloves. Get new gloves, non-sterile gloves. After I do hand hygiene, I'm going to come over and I'm going to look at the urine that has already started collecting into the bag. And I'm going to grab a stat lock, secure that patient to the patient's leg, and I'm going to attach the bag to the side of the bed, a non-movable piece of the bed, and we're going to document the color, consistency, odor, and color of the urine. Just lay that there. We'll act like it's hanging on the side. So now we'll say it's been a day or two later. We got an order to remove the Foley catheter. So I'm going to come in, introduce myself, do hand hygiene, provide privacy, and don clean gloves. So I'm going to, I'm going to tell the patient, Ms. Smith, we got an order to remove your Foley catheter today. Although it is going to be a little uncomfortable, it's not as painful as when we put the catheter in. Is it okay if I do that today? Okay, thank you so much. So before I move forward, I'm going to look at the color of the urine, document the amount, color, consistency. Okay, and now I'm going to pick the bag up. I'm going to remove the stat lock and everything. Right. So now I'm going to get a clean syringe. Right there. Hold on, I think we need to retake it. So as I was saying, I'm going to attach a new syringe, and I'm going to tell Miss Smith to take a deep breath. Deep breath. And I'm going to pull until I see bubbles, which I do. Perfect. And I'm going to examine the end of the tip to make sure it's intact and that to ensure that I see no pus or blood, and everything seems to look great. So I'm going to go ahead and dispose of everything, document my findings, and let the provider know. Thank you so much, Ms. Smith.